public health response plan, remember during SARS I introduced this acronym PDIP, PDIP. I know Madam Megawati likes it because the party is PDIP. Protect the borders, protect attackers. Detect and isolate, so that the moment you find a case, you detect, you isolate them from further infection. And the final P is, of course, personal hygiene. In fact, this time round, the last P, personal hygiene, is even more crucial compared to SARS. So let me spend some time on this. This time round, the public play a much bigger role than hospital staff in the war against this virus. SARS was not very infectious, but deadly. H1N1 is not the same. H1N1 is not so easy to detect, but is very infectious, but so far seems to be not so deadly. We need to deal with different threats differently. With H1N1, the government is separating anyone from Mexico, and we will watch where else the virus spreads to, and then introduce containment measures appropriately. But at some point, when the virus is in too many places, and we will not be able to block it further, we ourselves will get infected. And that's why I've been warning about cases appearing here and causing local clusters. It's a matter of time that such a scenario will happen here. We have bought ourselves some time with strong border controls and home quarantine order. Meanwhile, let's get ready at a community level. How? Up our standard of personal hygiene. Let's benchmark ourselves against the Japanese. And the Japanese are world famous for being clean and a very high standard of personal hygiene. Singaporeans are not. We are not there yet, but we can be like the Japanese. We ought to be like the Japanese. We are in a first world modern city, well educated, well informed. Let us be like the Japanese. We are not there yet, but let's use this crisis to up our standard.